Presentation notifications. Accessibility notice. If you have difficulty accessing any portion of this course with adaptive technology because of a disability, please contact the Office of Compliance and Ethics at 601-266-4466 or by emailing compliance@usm.edu. Resource notice. Due to the nature of the information in this presentation, you may experience an emotional response. Confidential support services can be accessed by contacting Student Counseling Services during normal business hours, Monday through Friday from 8 a.m. to 5 p.m. at 601-266-4829. For after-hours mental health emergencies, students can contact an on-call counselor at 601-606-HELP. You can also get immediate support 24/7 via the National Support Hotline of the Rape, Abuse, and Incest National Network, RAINN, RAINN, at 1-800-656-4673, or access their online chat hotline at https://hotline/rainn.org. If you need to report an issue, please contact our Title IX office by phone in Hattiesburg at 601-266-6804 or on the coast at 228-214-3363, or email them at title9@usm.edu. If you have any issues with the course, please contact training@usm.edu.
Hello, my name is Madison Estrada, and I'm a counseling psychology doctoral student at Southern Miss. I serve as a graduate student clinician at Moffitt Health Center and the Behavioral Health Clinic, and today I'm here to present on alcohol and drug information for USM students and employees. I would like to just start out with some presentation objectives. So by the end of today's presentation, individuals will be able to identify USM standards of conduct regarding substance use, including associated disciplinary sanctions for conduct violations. We'll have acquired increased knowledge pertaining to legal sanctions and penalties related to substance use. We'll be informed of health risks, including various physical and psychological consequences of substance use. And we'll have obtained information regarding resources available to them as USM students and employees, both services at the local and national levels. And then finally, we'll know where to access the annual notification on the USM Student Health Services website. So to get started, again, I ask that you go ahead and pause this presentation and read through the required alcohol and drug statement. Okay, so we're going to start with just covering some basic terminology. And so what I'd ask you to do to make this a little bit more interactive is go ahead and pause the video here and jot down what you believe to be the differences between substance use, substance misuse, and substance abuse. Okay, so let's start with use. So use is the ingestion without experiencing negative consequences. So if somebody is just using a substance, they are not experiencing any negative consequences from it. Misuse is experiencing negative consequences because of use. And then abuse is continued use in spite of continued negative consequences. So those who are abusing a substance have experienced these negative consequences and for whatever reason continue to use despite that. Another basic terminology to know is tolerance. So tolerance is when higher doses are needed to achieve a desired effect. And then withdrawal, which are when adverse symptoms occur that develop after use is discontinued. And withdrawal symptoms look a little bit different for the various substances, and we'll cover that today. So what is addiction? Well, addiction actually derived from the Latin root adicere, which means to adore or surrender oneself to a master. It is a habitual or compulsive use despite negative consequences accompanied by dependence and loss of control. There are two types of dependence. There's physiological dependence, when the body becomes dependent upon steady supply of a substance, and there's psychological dependence, which is when one continues to use a substance in order to meet psychological needs such as cravings. There are different elements of addiction. So it is a habitual pattern of behavior that's pleasurable and reinforcing. Behaviors become excessive and produce serious consequences. There are interrelated physiological and psychological components, so both in the body and in the mind. And there's difficulty stopping or modifying behaviors. So, what's a substance use disorder then? We've kind of covered addiction and we've talked through some elements. And today, I'd like to now move into just sharing with you what actually constitutes a disorder. So, when somebody has a substance use disorder, we see problematic patterns of substance use that leads to clinically significant impairment or distress as manifested by at least two of the following symptoms, which I'm about to share with you. And the two have to occur within the same 12-month period. So one could be substance is often taken in larger amounts or over a longer period of time than was intended. There's a persistent desire or unsuccessful efforts to cut down or control use. There's a great deal of time spent in activities necessary to obtain, use, or recover from the effects of a substance. There's a craving or a strong desire or urge to use. There are recurrent use present, resulting in a failure to fulfill major role obligations at work, school, or home. And then continued use despite having persistent or recurrent social or interpersonal problems caused or exacerbated by the effects of the substance. So I'm going to continue this list on to the next slide. But again, please note that a person just has to meet two of these in order to meet criteria for a substance use disorder. So continuing on, another one of those two could be important social, occupational, or recreational activities are given up or reduced because of use. Recurrent use in situations in which it's physically hazardous. Substance use is continued despite having knowledge of having a persistent or recurrent physical or psychological problem that is likely to have been caused or exacerbated by the substance. Tolerance, and then withdrawal. So again, just having two of those 11 criteria over a 12-month period can constitute a substance use disorder. So classification of drugs, we're going to cover a variety of substances today. And I think it's important to understand that there are various classifications when we talk about drugs. And so drugs are placed into one of 5 schedules, depending on potential for abuse or dependence, accepted medical use and treatment, and safety. So Schedule 1 drugs have high potential for abuse and dependence, and there's no accepted medical use and treatment. Now, there is some controversy with the way that these schedules have been defined, and so I encourage you to learn more about the schedules of drugs. Please visit the Drug Enforcement Administration's website or the DEA's website, as they're the organization that actually defines which schedule each of these drugs falls into. But just to go ahead and cover these schedules, and this is taken from the DEA's website, Schedule 1 drugs include heroin, ecstasy, LSD, marijuana, and peyote. Schedule 2 would include drugs like Vicodin, cocaine, methamphetamine, OxyContin, fentanyl. Schedule 3 would include drugs like anabolic steroids, Tylenol, codeine, ketamine. Schedule 4 would include drugs like Xanax, Valium, Ativan, Ambien, Tramadol. And then Schedule 5 drugs are those that are cough suppressants that have codeine. And so again, to learn more about these schedules, I encourage you to check out the DEA's website, and I have it listed there for you. So the substances that we're going to address today include depressants, stimulants, opioids, hallucinogens, cannabinoids, and anabolic steroids. And so I encourage you to pause the video here if you'd like a more interactive experience, and go ahead and jot down a couple of facts you already know about each of these categories of substances. Okay, so starting with depressants. These are also called sedative hypnotics, and they slow down the functioning of the central nervous system. These include things like alcohol, benzodiazepines, and even things that are used for date rape drugs. Routes of administration, typically oral, and major effects include relaxation, disinhibition, impaired judgment, poor motor control, decrease in reflexes, slurred speech, and drowsiness. They have a synergistic effect. So the effect of one drug is enhanced by the presence of another drug. So there can be some drug interactions that actually intensify those major effects listed there on the slide. So the potential for overdose is high, and tolerance can develop very rapidly. Cross tolerance can also develop. So if an individual has a high tolerance for alcohol, for example, they're likely to have a high tolerance for benzodiazepines as well, or vice versa. Withdrawal effects include irritability, loss of appetite, tremors, fever, insomnia, seizures, and even death. And chronic effects include memory loss, ulcers, cirrhosis of the liver, fetal alcohol syndrome. And we're going to talk even more about what some of the short and long-term effects are of alcohol specifically. So because alcohol is one of the most commonly used drugs out of the depressant category, I'd like to focus in on that now. So let's speak to the prevalence of college student alcohol use. So the prevalence of drinking, about 59.8% of college students drank alcohol in the past month, compared with 51.5% of other persons of the same age. So being in college does or can foster increased use environments. Prevalence of binge drinking, so 37.9% of college students engaged in binge drinking, compared with 33.5% of other persons of the same age. And prevalence of heavy drinking, so 12.2% of college students compared to 9.5% of other persons of the same age engaged in heavy drinking over the past month. So let's define that a little bit further. So what are these drinking levels? Well, moderate consumption would be up to 1 drink per day for women and up to 2 drinks per day for men. Binge drinking would be 4 or more drinks in 2 hours, 3 or more drinks in a day, or 7 or more drinks in a week for women, and then 5 or more drinks in 2 hours, 4 or more drinks in a day, or 14 or more drinks in a week for men. Heavy alcohol use is defined as binge drinking on 5 or more days in the past month. So the short-term effects of alcohol use, we can see here in this graphic, really affects a plethora of body parts and areas of our body, areas of the brain. And so there's not very many body parts that go, that can escape the effects of alcohol. So it really is a multi-systemic effect whenever we use alcohol in the short term as well as in the long term. So we can see here mental health and addiction. There can be numerous effects on the body, on the organs, skin, of course, the pancreas, the liver, sex organs as well, brain and nervous system. And so really, again, this is a multi-systemic effect whenever we look at alcohol use on the body and the mind. So consequences of college student alcohol use, well, nearly 2,000 college students die from alcohol-related unintentional injuries, including motor vehicle crashes. 696,000 students are assaulted by another student who had been drinking. 97,000 students report experiencing alcohol-related sexual assault or date rape. And these numbers are kind of the average number of the past year. Roughly 20% of college students meet the criteria for alcohol use disorder. So when we covered those various criteria at the beginning of today's presentation, that's what we're referring to here. And about 1 in 4 college students report academic consequences from drinking, including missing class, falling behind in class, doing poorly on exams or papers, and receiving lower grades overall. So I wanted to share some information about driving under the influence or DUIs, and particularly as this relates to alcohol. So although DUI is more commonly associated with alcohol-related incidences, it can be really under the influence of any substance, legal or illegal, really anything that impairs driving. So in 2014, alcohol-impaired driving fatalities accounted for nearly 10,000 deaths, 31% of overall driving fatalities. And despite all states agreeing on the drunk driving limit being 0.08%, the punishment for a DUI offense does vary across the US, and that's important to know. So let's talk about DUI penalties in Mississippi. For under the age of 21, we can see here there are quite a few levels to this. So it depends on, first offense, second offense, or third offense, but it can be up to a fine of $1,000, license suspension for 2 years, or until the age of 21, and completion of a certified alcohol or drug program. For adults over 21, again, there are various levels here based off of first offense, second offense, or on, but this can really go up to, $2,000 to $5,000 for fines, 1 to 5 years at the state penitentiary, and then license suspension for 5 years. Also, felony conviction can be an outcome of a DUI in Mississippi as well. So the USM amnesty policy, I would encourage you to go ahead and pause the video here and read over this. I'm not going to read this verbatim for you, but I would ask that you go ahead and pause and read. And the same for the USM disciplinary sanctions. Go ahead and pause and read over this. So guidelines for responsible alcohol use. Don't drink unless you are 21. Never drink alone. Eat something substantial before drinking. Know what you are drinking. Never accept a drink from someone you don't know. Always watch your drink being made. Never drink from a punch bowl. Know where your drink is at all times. Know how much you're drinking. Avoid drinking games. Avoid drinking shots of liquor. Drink slowly. Avoid gulping or chugging. Space out your drinking. Alternate alcoholic and non-alcoholic drinks, and avoid trying to keep up with or out drinking others. And continuing on with some additional guidelines for responsible alcohol use, avoid mixing alcohol and medications, stop drinking at a predetermined time, leave the bar or leave the party at a predetermined time, make sure you go home with a friend, respect the rights of individuals who do not wish to drink. Alcohol and sex do not mix, so drunken sex is not consensual sex. Avoid getting into a car with someone who has been drinking. Never drive a car after having had a drink. Use a designated driver. So I hope that you're able to take away at least 2 of those tips to become, an even more responsible user when it comes to alcohol use. So now let's switch gears and talk about stimulants. So stimulants speed up the functioning of the central nervous system. They include drugs like cocaine, amphetamines, caffeine, nicotine, and Ritalin. Routes of administration include oral, smoked, snorted, injected. The major effects include euphoria, self-confidence, alertness, elevation of mood, increased heart rate, and suppressed appetite. The potential for overdose is high, and tolerance can develop rapidly. Withdrawal symptoms include headaches, irritability, restlessness, insomnia, depression, and lethargy. And chronic effects include strokes, cardiovascular problems, malnourishment, depression, paranoia, and even suicide. So we're going to switch gears and talk a little bit about tobacco and vaping. We're going to spend a little more time on this, but this does fall under the category of a stimulant. And so I'd encourage you to go ahead and pause the video and make a list of body parts that you believe are impacted by smoking nicotine. All right, so risks from smoking. Again, this is a multi-systemic effect when we look at what this does to our body, but it can lead to chronic diseases like strokes, blindness, gum infection, aortic rupture, heart disease, pneumonia, hardening of the arteries, chronic lung disease and asthma, reduced fertility, and hip fracture. Again, multiple systems being impacted here. And talking a little bit more specifically about e-cigarettes or vaping, these are actually called electronic cigarettes, but e-cigs for short. There are other names you can see there on the screen that you may hear whenever an individual is referring to vaping. Some look like regular cigars, cigarettes, or pipes, but others look like pins or USB flash drives. And their jewels specifically are available in a variety of flavors, including fruit, cool cucumber, mint. So these tend to appeal to younger populations. A jewel pod contains the equivalent of 20 cigarettes. And I think that's important to take a moment and let that just sit in. 20 cigarettes in one jewel pod. Research shows that those who begin vaping have a higher incidence of moving on to using regular cigarettes. And e-cigs can be used to deliver marijuana and other drugs as well, not just nicotine. But USM is a tobacco-free campus. And so this came into effect on January 1st of 2018. And the benefits of this is that we're promoting a cleaner, healthier environment to learn, grow, and enjoy all that the university has to offer in academics, research, arts, athletics, and service. And so the goal of becoming tobacco-free as a campus, as a university, is to create an environment in which those on campus feel encouraged and empowered to make healthy lifestyle decisions to influence overall health for a lifetime. And what's awesome about that is research shows for college students, if you're able to adopt healthier habits while you're in college, it becomes that much easier to live a healthy lifestyle post college years. So I do want to include here some smoking cessation resources. So if you are trying to quit smoking, I encourage you to pause the video here, get out your phone, take a picture of these resources, whatever you need to do in order to really get some support behind the goal that you are really trying to obtain. So these resources range from different programs to quit lines, so phone-based services, to apps for your electronic device, and even some medication options, which that last bullet point there, as a clinician, I have worked with individuals on smoking cessation, which yes, can be treated behaviorally, but I've also seen individuals who have started on Chantix while undergoing psychotherapy and have had a lot of success from that. So I always encourage individuals, if you're thinking about the medicine route, consider the phrase pills don't teach skills. So it is good to also adopt some healthy skills and make some behavioral changes, but do know that there are some great options out there to help reduce cravings as well. All right, so moving into opioids. So these are also called opiates, narcotics, and analgesics. They're used for pain relief and cough suppressant. These include medications or drugs like morphine, codeine, heroin, Oxycontin, and Vicodin. Routes of administration are oral, smoked, snorted, and injected. Major effects include euphoria, pain relief, cough suppression, constipation, vomiting, itching, and sedation. The potential for overdose is high, and tolerance and physical dependence can develop rapidly. Withdrawal symptoms include runny eyes or runny nose, sweating, muscle cramps, nausea, restlessness, and diarrhea. And chronic effects include, the risk of of disease, so by sharing needles, for example, as well as nutritional deficiencies. And I wanted to take a moment and share this graph from the CDC website, which shows overdose death rates involving opioids by type in the United States from 1999 to 2018. And as you can see there, the death rates have really gone up, particularly for synthetic opioids, but overall, just any opioid in general, we see that has really been on the rise. So we do have a pretty serious situation on our hands as far as overdose death rates go with opioid addiction. All right, so switching gears and speaking on hallucinogens, some hallucinogens are used in religious ceremonies. Some examples include LSD, mushrooms, PCP, ketamine, which is also known as Special K, and peyote. The routes of administration are oral, smoked, snorted, and injected. The major effects include altering of sensations and perceptions and states of consciousness, as well as increased blood pressure. The potential for overdose is low. However, individuals do describe having what's called bad trips, and this is really can have long-lasting effects. So an individual can have paranoid ideation, hallucinations, or confusion that persist even for 1 to 2, even longer years after they had this bad trip while high. Tolerance can develop, and physiological dependence is rare, but psychological dependence can develop. And the chronic effects include flashbacks, which is one of those kind of effects from the bad trip, increased blood pressure, dizziness, depersonalization, delusions, and paranoid psychosis. Cannabinoids are what we're going to cover next. And this obviously includes things like marijuana, hashish, and ganja. And so the active ingredient here is THC, and the routes of administration are oral or smoked. The major effects include relaxation, increased appetite, altered sense of time, impaired memory, enhanced humor, increased blood pressure, bloodshot eyes, dry mouth, and decreased motor skills and reaction time. The potential for overdose is low. However, tolerance can develop, and physiological and psychological dependence can develop as well, particularly if an individual is using this as an attempt to treat things like sleep difficulties or to treat things like anxiety or appetite loss related to depression. So an individual can become dependent on these things physiologically and psychologically, feeling like they can't cope with anxiety, for example, unless they use marijuana or whatever type of cannabinol it could be that we're talking about here. So withdrawal can include irritability, restlessness, decreased appetite, insomnia, tremors, and chills. In addition, if somebody is using marijuana to try to self-medicate anxiety, when they discontinue use, they can have what's called the rebound effect occur, which is when anxiety intensifies worse than ever before and really just bounces back and hits them in the face. And so if you are currently a user and you're looking to quit using, I do encourage you to get connected with a behavioral health clinician who can help you through that process. And again, learn some good skills so you're not having to depend on a substance to get you through these hardships. Chronic effects can include suppressed immune system, decreased male and female hormones, damage to the lungs, impaired memory, and decreased motivation. All right, so moving into the category of inhalants, these are chemicals that can be just legally purchased and available in your home. These include things like gasoline, glue, nail polish remover, paint, nitrous oxide. The routes of administration are sniffing, or sometimes referred to as huffing. The major effects include decreased inhibition, euphoria, dizziness, slurred speech, drowsiness, giddiness, headaches, and ringing in the ears. Tolerance can develop to nitrous oxide, and chronic effects include loss of consciousness, coma, cardiac arrhythmia, asphyxiation, damage to the liver, damage to the kidneys, the brain, the lungs, and even death. All right, so moving into anabolic steroids next. These are synthetic drugs used to increase muscle mass and improve athletic performance. I have a few examples listed here. And oral or injected is typically the route. And major effects include increased muscle strength and mass and potential increased aggression. There's mixed research on that component. Potential for the overdose of anabolic steroids is low. However, while tolerance does not seem to develop physiological and psychological dependence can develop. And so a person can really start to believe that they cannot make it through, life without these, particularly if they have very low self-worth and high anxiety. If they stop using anabolic steroids and start to lose muscle mass, this can lead to very intense depression for somebody. And so they can have a psychological dependence develop. Physiologically, they can also have some uncomfortable withdrawal symptoms, such as restlessness, insomnia, loss of appetite, decreased interest in sex, and these withdrawal symptoms can lead to that physiological and psychological dependence. And as you see there, depression and fatigue can also be a symptom of withdrawal. And chronic effects include atrophy of the testicles, infertility, early baldness, and acne for men. And for women, increased facial or body hair and cessation of the period. Increased risk for coronary artery disease, increased chance of mood swings and irritability are also chronic effects that can occur for either genders. Okay, so we've covered a lot of information already about addiction, substance use disorders, and these various categories of substances. And so now I'd like to share with you some resources that you can turn to if you're finding that you're trying to, pursue some help in any of these areas, or if you know somebody who is. So at USM, you can check out the services offered by Student Counseling Services. And I have the Hattiesburg phone listed there, as well as the Gulf Park phone. And Student Counseling Services also offers emergency around-the-clock services, and I've listed their emergency number there as well. There's also the Behavioral Health Clinic, and so not only do we provide individual therapy to help individuals through difficulties like what I've covered today, but we also offer thorough assessment and evaluation skills if anybody needs to be assessed or evaluated for any of these difficulties. And then Moffitt Health Center as well. And so if you'd like to speak with a medical provider there, then there are definitely a lot of people who'd be happy to help you. And then also we offer a program called Eagle Checkup. So if you're a student and you would like to see how your alcohol or marijuana use compares to that of the average student, and would like to learn more about how to reduce harm when using, so kind of doing some harm reduction strategies, then you can get in contact with Lisa Wright, and I have her email address listed there on the screen. So this program is not meant to help you quit using necessarily, unless that's a goal that you have. It's not meant to tell you that you have a problem. It's really meant to educate you so that you can see how your use compares to those who are similar to you. Some additional USM resources include the Title IX office and Campus Action Referral and Evaluation System. And so the phone number there is listed for the Title IX office. So if you have, if you're needing to make a report of harassment or discrimination, then that is the number to call. And then if you have a concern about anybody on campus, be that a student, faculty, staff member, whoever it is, then you can submit a report to the CARES team, and the CARES team can follow up with that individual and see if they can get them some assistance or some resources so that they can really make sure that they're safe and as healthy as possible. I've listed here some community resources, and I encourage you to jot these down. Again, pause the video and jot them down or screenshot these services, as well as some national resources. And so again, I encourage you to jot these down. Even if you don't need these resources for yourself, you never know when you'll come into contact with somebody else who does or could benefit. And so these are just great resources to have typed into a notepad in your phone, just in case. And then also a list of mutual support groups. So Alcoholics Anonymous, Moderation Management, Narcotics Anonymous, secular organizations for sobriety, Smart Recovery, and Women for Sobriety. So if any of those appeal to you or you know anybody who could benefit from them, again, I encourage you to jot down the number or to go to the corresponding website to learn more. And for more information, I encourage you to read through some of the resources on USM's website.
Now let's take a look at some of those resources. Hi, welcome to this section, which is information that is on the Student Health Services Office of Health Promotion site. This is useful information that we wanted to highlight for you in terms of drug and alcohol information, as well as some bystander information. So the first thing I want to highlight here is the annual alcohol and drug report. The first thing I want to highlight here is the annual and drug notification. It's found off of the https://www.usm.edu/student-health-services/office-health-promotion.php. And you can then open these reports. They contain information both about our drug notification, which talks about the risks of alcohol from a legal standpoint, as well as the impact to your health. We also have our biannual review, which lists all our programs we've done here at the institution, as well as information about policy as specialized programs for different departments. So we definitely want to highlight that for you. In addition to that section, there is also information about the tobacco-free USM policy. On the left-hand menu, you click on tobacco-free. Let's just know a little bit more about the policy itself, frequently asked questions, and tobacco cessation guidelines. We go back to our Office of Health Promotion site. We can go back to Health Resources. When we click on Health Resources, there's also information about alcohol and drugs on the Health Resources page, including a link to our alcohol policy and resources for improving student well-being, some facts about alcohol drinking, alcohol poisoning, as well as information about a variety of other drugs that you want to steer clear of, and the potential for abuse and addiction, including very useful list of signs and symptoms of drug abuse. We go back to our health promotions page. I also want to highlight one other thing, which is actually two other things. One other thing is the Student Health Comprehensive Guide to Staying Healthy in College, and it is a guide about overall student health, nutrition, sleep, diet, exercise, sexual health. It's a guide about overall health, but it does include a section on alcohol and drugs. Finally, if you go back to your health resources, there is a section on healthy relationships and bystander intervention. So you'll see here, there's information about healthy relationships, and there's also bystander intervention, including information on what is a bystander and how an active bystander helps others. We do offer training. Relative to bystander intervention. It's called Green Dot, and it is offered intermittently. Look for information on campus about it. This free training is very valuable and could prove a great resource to yourself. A few words from our Title IX office.
How do I report if I'm a victim or witness of sexual harassment? There are many ways that you can report to the Title IX office. The first is to report in person. The Title IX office is located in Cook Library, room 129 on the Hattiesburg campus, and in Hardy Hall, room 332 on the Gulf Park campus. You can also report by phone. You can also report online through the Title IX website, usm.edu/Title9, by clicking Report an Incident button on the homepage. You can also contact us via email at title9@usm.edu. You can also report anonymously through the University Ethics Hotline. Our newest reporting platform allows you to report from your personal smartphone through the iSouthern Miss app. This app is compatible for both Android or Apple products. The Title IX page has information on how to file a complaint with our office, links to our policy and procedures, as well as information for on and off-campus resources.
Okay, and here are my references. And I would like to just thank you so much for your time and your attention. I hope you were able to pause the video at moments and to jot down some different things to interact with this training. Otherwise, thank you for your time and your attention. I hope that you learned something new today, and I appreciate everything that you're doing individually and then also along with others to make USM a healthy and safe campus. Thank you and have a great day.